here's trick number one. First thing when you wake up, you want to drink a really large glass of water, like 12 or 16 ounces, or maybe even more if you can do it. And you want to do this first thing in the morning because then that water can go towards cleaning the system out. It's not going towards helping digestion and doing all these other functions that the body does during the day and uses water for. If you drink this large glass of water right when you wake up, it'll just go towards cleaning the system out. And that can help wash out some of that junk that's thickening up the blood and raising the blood pressure. So just put that 12 to 16 ounce glass of water right by your bed so it's there when you wake up and you remember, and drink that first thing in the morning, and I think you might be surprised at how quick your blood pressure can come down. Step number two is to improve bile flow, and this seems to be the most crucial step for the largest percentage of people. And it makes sense because how are you going to lower blood pressure if the body can't get rid of filth and toxins? If all that junk is accumulating and thickening up the blood, how are you going to lower that blood pressure? So improving bile flow is really a big deal for a lot of people. Step number three is to bring down your fasting blood sugar number. So if you test your fasting blood sugar and it's over 100, that really needs to come down to have any chance of really getting your blood pressure down. We do that by reducing the carbs and sugars, and especially liquid sugars that we're consuming. And that doesn't mean that you can never have a carb. That can be very difficult for some people to do. But you can change the types of carbs that you're eating, and then you can change the timing a little bit, and you can cycle those carbs into the day in a way that allows that blood sugar to come down and allows insulin to come down. Now, if you're having really bad carb cravings, you may have some digestive malfunctions that are restricting your ability to access nutrients in either proteins or fats. So the body's kind of just screaming for, give me these carbs that are really easy to break down and get fuel out of. And if you're leaning too far insulin resistant and the cells are not receptive to glucose and not able to use glucose correctly, then those cravings can be magnified even more. And step number four is to simmer down now. Remember, we want to try to relax a little bit and pull our body out of that sympathetic fight or flight state. Because when the body is stuck in that fight or flight state, it constricts the vascular system, and that's going to raise the pressure needed to push blood through the system. This doesn't mean that you need to remove all the stress from your life, but what you can do is you can remove a stress from your life. So figure out something that you can remove that's going to reduce a little bit of stress from your life, and just count that as the first step. Now you're taking steps to reduce the stress and the amount that you're pushing yourself into this fight or flight state. The next thing you want to do is you want to reduce any stress that the body may be dealing with that's causing you to push into this fight or flight state. If you're having some type of infection or chronic infection or some type of digestive infection, you want to take steps to take care of that to reduce that stress from the body. Then all you got to do is watch that pulse pressure. If you start seeing that number go lower and lower and go below 46, you know that you're really moving out of that sympathetic fight or flight state.